What we have in our call center is a new Freedom-funded mobility manager as the call center staff. She also does some other mobility management activities, which I'll talk about. And the transportation manager, that's me, as the backup person for the call center. So we do a lot, I think, with very little resource. The New Freedom funding started in January of '09. We had done some planning to begin with, but we were up and running by April 1st of '09. Our first month, we had 36 INR calls. Within 6 months, we were getting 200 calls a month, and we're up to about 250 or 275, so it's starting to plateau. We are redoing our department website, so it's easier to access information. Lots of, as Virginia said, lots of times people don't present with transportation as their main issue, and in fact, transportation was pretty buried a couple of tiers down in our website. So what we do with our call center is information and referral calls. We do some eligibility determinations for the aging programs and the other human services transportation programs. We refer to often county workers to do Medicaid eligibility determination and to the metro system to do paratransit eligibility. We work pretty closely with the benefit specialists in the aging unit to talk to them about, because as Virginia said, people don't present transportation as their issue oftentimes, and so we work very closely with the benefits specialists. We have developed one form, and this was kind of a little project, trying to get one form that would really get at all the issues for all the different programs. And there are, of course, for some programs, irrelevant questions on the form, but we tried to get it as streamlined as possible. Two things was to make it work for everybody and also to make it shorter so that the consumer didn't feel like, the form itself was a barrier. We also do eligibility determinations for, I want to move this closer so I don't feel like I'm hunching over this. Eligibility determinations for mobility training. We fund the mobility training and we refer people to it. We don't actually do it. That's a subcontract with an agency that has occupational therapists, certified occupational therapists doing it. But we also have a couple of really innovative mobility training programs, which I am kind of excited about. One of them is that we have a time bank in Dane County, which is similar to a barter network. Barter usually works that if the doctor sets your arm, you give him a chicken, that's barter. But this is a system where you, oh, now I'm supposed to be farther away. Okay, good. So you basically put time into a bank so that I might help my neighbor paint her house, and then somebody else will help me fix my car. So we have time bank volunteers training people with less experience on the transit system to use the transit system. And honestly, the way we started this was a young man with a developmental disability who really knew the transit system was helping other folks with developmental disabilities use it. And so we've built from that model, and we have a time bank system. We also have a senior bus buddy system where folks this was largely driven by the fact that the increase in home-delivered meals was beyond what our volunteer driver program could handle. And we started to wonder why folks were using home-delivered meals, and it turns out they were shy about using the buses. So we now have a bus buddy program that will ride with people on the senior buses. We also had a number of folks who were using volunteer drivers for grocery shopping, and since we have routed bus trips in every community to go to the grocery store, we wondered why that was, and we found that some people simply couldn't handle the cart. And so we have volunteer shoppers. That was a magnificent success. We had more volunteers to be volunteer shoppers than we had people who wanted to use the shopper. The volunteer shopper goes on the senior bus with a couple of people and helps them shop. And then we're using that low-cost group transportation system. We also have a coordination project going between, as I mentioned earlier, the adult daycare routes. The folks who are on paratransit now are on the dedicated system that the county funds for a much lower rate. And we have done a similar thing with the county routes to supported work sites. We get coordinated rides for other kinds of employment for either people with disabilities or low-income people. So one of our biggest problems in Dane County has been the lack of access for people who need accessible transportation to Medicaid providers. Our state Medicaid van program is coordinated through the state, not through the local area, and there's a capped rate on that, and a number of providers had no longer been willing to provide Medicaid rides for that rate. So people were riding the transit system and paying the fare, which was transferring the cost of those Medicaid rides to the local program. So we started, it was a very simple program. The county agreed that we would authorize Medicaid transportation for paratransit riders who are Medicaid eligible. We have the ability to check that. We would authorize them for certain destinations that we had verified that they were receiving medical services at that destination, and then sent out a postcard to all of the paratransit riders and said, you may be eligible for reduced fare, because you don't pay a fare with Medicaid. You may be eligible for reduced fare if you call the call center, and they did. 600 calls the first day after that card went out. But the advantage to the riders, they don't pay the fare, and the advantage to the transit system is that the county reimburses them for their cost per ride for that Medicaid ride. So it's no longer being subsidized by public dollars. That also goes through our call center. We do out-of-county travel. Madison is kind of a medical center, but we do have folks who, for one reason or another, have to do out-of-county or out-of-state travel. We do those kinds of difficult-to-serve rides where we have, for instance, children of incarcerated parents who are moving to relatives out of state. Lots and lots of problem solving. We have a large non-English speaking population. We've worked out both volunteer drivers and a van service that provides transportation with a driver who speaks that particular language. We have a lot of Southeast Asian, a lot of Spanish speaking, and a lot of Russian speaking people. We have difficulties with certain kinds of rides, oversized wheelchairs, same-day service, transportation for wheelchair repair. Medicaid will pay for the wheelchair repair, but they don't pay for the transport for the person who then is using a different kind of chair. Certain kind of complicated rides. We have mental health clients who are being transferred from one facility to another and need some secure transportation. Probably my favorite ride ever was a woman who called me at 4 o'clock on a Friday afternoon because she wanted to, before Memorial Day, because she wanted to go clean the graves of her husband and her daughter, who turned out to be her only child. And she couldn't get to the military graveyard, which is way in the back, because she uses a walker, and her friend was going to drive her, and she can't drive her. Like, I'm going to say no to that. So we do all kinds of sometimes lengthy problem solving with people, and the advantage to having a call center, of course, is that you know what kind, who you can call and what kinds of services. The woman who wanted to go, for instance, to the gravesite, we found volunteer drivers who had accessible vehicles, who were willing. One drove her out and one drove her back, and they were willing to communicate with each other. And that was a fair amount of negotiation, where you could imagine somebody calling, 5 different places trying to find a ride. Probably somebody would have volunteered to do it themselves. I almost did. The other thing that we do is we coordinate with mobility managers in other counties. As I mentioned, Dane is kind of a medical and employment center, and oftentimes we'll have people who are coming from a considerable distance. And oftentimes volunteer driver programs or aging programs only are funded to cover their county, and so those inter-county issues are sometimes need some negotiation. We do some coordination across programs. And I have to say that the area where we are probably most lacking is that, we're social workers, and so to buy software to identify what software will help us has been a little bit of a challenge. we would be much more effective if we had good software backup. But we do ride coordination across programs. For instance, we have a woman who comes in for dialysis from a rural area who we coordinate a ride with somebody who comes in for another disabled woman who comes into Madison to work, and they've managed to work the dialysis schedule and the employment schedule out so that they ride together. That kind of information is, those are two people from two entirely different programs. And so, getting a coordinated ride between those folks was a real benefit for the call center. We coordinate both on the level of the individual ride, like that example that I just gave you, and also on the level of funding and programmatic coordination. So we have a number of city and county, City of Madison and county funding arrangements. I mentioned earlier the adult daycare program where we worked out, not just between the city and the county, but also a private provider to make sure that we didn't have duplication of services. The city also funds our volunteer driver program because that keeps people off paratransit. And they provide some funding for our senior transportation, our group routes. Again, those reduced paratransit rides. And we have a lot of multi-jurisdictional coordination. We have in the rural part of the county shared ride taxi systems that are only funded to serve their county, but we have folks who either for medical or employment reasons need to have interjurisdictional travel. And so the county coordinates agreements between those shared ride taxis and, for instance, the transit system in Madison to get people across jurisdictional lines. I think county human service agencies in some ways are kind of uniquely positioned to coordinate on all those levels. You have a lot of information from aging units, from disability units, and we are able in some areas it's more difficult to coordinate with our ADA paratransit. But we're starting to explore some other things as well. A multi-county information coordinating council for both information and referral and for access, so that somebody in one county could actually authorize a ride that would include transit in Dane County or vice versa. We're also talking about using transfer points for people who are coming into the edge of Dane County and then can transfer onto the metro system, but who may need some assistance at the transfer point. So making sure that there's somebody there to assist them, both for people who are coming into the transit service area and for people who are using a transit hub. We have a supported work site that's just outside the central city area, and lots of folks who are at that supported work site could actually use fixed route buses if they had somebody supervising the transfer. So we're working on things like that. One of our programs that is just in its infancy, but it worked in the one case that we've tried it, was that we had some youth court kids who were sentenced to do community service who had been disrupting a transfer point and in particular bothering people with developmental disabilities. They were just that rung lower on the socioeconomic system that they were bothering them. With the Youth Court Restorative Justice Program, these kids were given a couple of people with developmental disabilities to actually assist every day. And they did, and those were their guys, and they made sure they got on the bus. So that was an extraordinarily successful program that we'd like to, continue that sort of, working across systems like the criminal justice system and and transportation. How's that for working across borders? So I think that for the 2 years that we've been doing the call center, we've gotten a lot of interesting and innovative programs started. And a lot of that has been because there's been a lot of community support for working on these. Everybody has an anecdotal story about somebody who couldn't get a ride somewhere. And it's, accessing those stories and getting people to work together on it that's been really helpful.